Hello everyone, this is Tim Hurley, sales engineer for RL Kistler Inc. I thought I would take a moment while many of us are working from home to bring you some updates on Vertiv and RL Kistler through various forms of short presentations and videos. Today, let's discuss and review healthcare trends and drivers driving healthcare today. CV-19 is the driving force obviously today, creating shortages of everything including IT, but also opening up incredible opportunities to provide real solutions to the healthcare industry when it absolutely is needed the most. I'll be sharing some of the bigger trends being seen today by industry experts and 5 key trends you can take with you. Today's healthcare sector is comprised of healthcare facilities, hospitals, laboratories, outpatient facilities, clinics, long-term care, etc. Providers and services, doctors' offices, laboratories, telemedicine. Managed healthcare, Aetna, Cigna, Humana, United Healthcare, CDPHP, pharmaceutical, Bristol Myers, Pfizer, Lilly, Regeneron. Healthcare equipment and distribution, companies like Baxter, Becton, IDEX, Boston Scientific, Thermo Fisher Science, American Hospital Supply, Cardinal Health, and more. And drugstores, Walgreens, CVS, Rite Aid, Express Scripts, drugstore.com, Walmart, and so many more. And then there's companies that focus only on IT for healthcare. Companies like Cerner and Epic. So as its own vertical, healthcare is the second largest service sector employer in the United States. So overall, what does that look like from an opportunity perspective? This is an industry breakdown based on the average across the country. I won't read the slide to you, but you can see the 1 to 10 rule is prevalent throughout the slide. And don't think of healthcare as just hospitals. Today, with segmentation and collaboration, it is so much more, as we can see through all these various breakdowns of healthcare as it's looked at from the overall view today. So let's take a look at our first key trend in this deck. Patient acting as a consumer. Because of all the information available today, patients are much more savvy and in tune with technology advances and want that in their individualized healthcare system, including where they get their care. And that's why you're seeing an outcropping of outpatient facilities, micro hospitals, and ambulatory care. They're popping up everywhere. And the trend is moving towards occupying former commercial and retail spaces, bringing that service closer to the patient. This type of renovation often costs less than new construction, and even if there's adaptations that have to be made in the building, they are still providing services similar to larger hospitals, emergency department, pharmacy, lab, radiology, surgery, but in a smaller envelope. This model offers great accessibility and convenience for residents and is a cost-effective market growth strategy for providers. These mini hospitals often range from 15 to 50,000 square feet. They're open 24/7. They have beds for short stays. They do same-day medical procedures, and they focus on wellness, prevention, diagnosis, treatment, and rehabilitation. Innovation is key with the delivery of healthcare today. Hospitals and health systems are shrinking the number of inpatient beds and thinking like retailers. New distributed footprints include outpatient services that are located closer to where patients live, in places like supermarkets, drugstores, and a growing number of off-campus medical buildings that are creating a big demand for mission-critical edge sites. Technology will play the key role in this new service model. Healthcare providers are deploying innovative care delivery models based on data and analytics. So here's one key takeaway from this. A successful transition to value-based care requires that market players and consumers move beyond transaction-based treatment to the holistic health of populations, from treatment to wellness and prevention, from individual to population health. Healthcare providers can also look at deploying innovative care delivery models based on data and analytics. AI, IoMT, the Internet of Medical Things, or IoHT, the Internet of Health Things, telemedicine, all will require low latency on-site delivery of data, creating great opportunity for mission-critical edge because of delivery, storage, and security. These are the parts that are transforming our care delivery for tomorrow. Security is critical, and it does impact everything. IoMT will need to be ubiquitous and secure, flawless by its requirement and environment for distributed care to work, and for those using it to have a minimized security risk. Mergers, acquisitions, joint ventures, and affiliations. More organized way to deliver care and greater coordination among participants in what were once distinct verticals that will provide better management of population health, efficiencies and economies of scale, growth through scalability of clinical operations, financial strength through becoming more value-based care delivery by streamlining services and blending technology and financial and capital strategies to bring greater capabilities to health systems. And the trends of healthcare growth are really unquestionable. In 2019, 30% of healthcare executives said that their budget would grow more than 20%. I think with what's going on today in 2020, I think both the quantity and the percentage will be much higher as we go through this CV-19 outbreak. Also, as we get through more mergers and acquisitions, there is more disparate systems that are resident in the acquisitions. So now is the time to help healthcare grow, to meet the future needs of the compilations of the trends and drivers that we've reviewed. Being that partner that will help them understand the critical role of IT and infrastructure will bring an even stronger bond and trusted partnership. So remember, these vital healthcare applications and initiatives are driving the IT investment because technology is the main driver for change, no matter what industry you're in. But in healthcare facilities specifically, the patient-centered approach now goes beyond doctor-patient interaction to include the healthcare facilities crucial to treatment and recovery, from accessible digital records and 24/7 patient monitoring to visual engagement and wireless connectivity throughout a facility. The technologies that improve patient care and the patient experience are essential to a modern healthcare facility. These new investments in technology will create a connected infrastructure that integrates data and information in the cloud and is available everywhere the patient is. So earlier I mentioned IOMT, IOHT. Healthcare executives are increasingly investing in artificial intelligence and machine learning. These technologies are most likely to come into play for organizations seeking efficiencies in areas like back office operations or supply chain, forecasting. The rapid digitization of health data through the use of health information technology in the United States has created major opportunities for AI. Innovators and experts see potential in digital health data to improve healthcare and health outcomes from the home to the clinic to the community. And as a side note, 3D printing in healthcare is skyrocketing. And the list of objects that have already been successfully printed in this field demonstrates the potential that this technology holds for healthcare in the near future. Lower cost prosthetics, medical models, bones, heart valves. Harvard is working on developing a prototype to make tissue from blood vessels. And drugs. Prototyping a 3D project, assembling a chemical compound at the molecular level. Patients would go online drugstore with their digital prescription, buy the blueprint and the chemical ink needed, and then print the drug at home. And of course, today we already have remote care monitoring that makes it possible for clinicians to track and manage patients in their homes, and outpatient online scheduling which provides a much easier access to physicians and their clinics. So we've had some key takeaways throughout this short presentation, and I wanted to take a look and let you know what is coming. So these are some of the communications device management that is on the run. It's on the move. Enterprise systems and platforms that are going to be part of the healthcare system today and tomorrow. Organizations may meet some of the objectives of care delivery through digitization of their healthcare system. But at the outset, keeping pace with rapid technology developments is likely to require massive investments in electronic health records, interoperability, and big data, amongst others. Organizations are being told to consider strategic investments in people, process, and premise that are enabled by digital technologies. And as we migrate into 5G and 5 gig, adapting more of a hub and spoke mentality that will require a much stronger edge environment, planning today will bring greater success tomorrow. So as we move towards wrapping up for today, here's some of the key takeaways on one slide. It really is the right time to sell Vertiv into healthcare. The new focus on patient experience, healthcare delivery at distributed sites of care, looking to improve margins to be more efficient are going to require infrastructure improvements and equipment upgrades. New efforts to create cost-effective delivery models are going to be prevalent. Increasing compliance are going to be difficult to manage, and they're going to need help from a security and storage perspective. Merger and acquisition activities over the past few years have created some very large healthcare conglomerates, but they have disparate systems and practices that need to be brought together. Vertiv has the strong foundation and lots of growth potential in healthcare, and more importantly, can be that trusted partner to you to help your customers. And that's it. A little longer than normal, but I hope it was worth your time. I appreciate your time today. I always make myself available for virtual joint calls, virtual walkthroughs, and general follow-ups with you or your teammates. As always, stay safe and be well. Thank you.